You gain independence and self-confidence. You learn.
Good evening. This is Cambridge InsideOut. We are here on part 2 of tonight's show. My name is Susanna Sagat. And
I'm still Robert Winters.
And I'm Sal DiDomenico, in case you didn't know. So.
I was,
welcome back.
See, I envy the Italians because you guys get so many syllables in your names.
We
I
do.
get like 2 and 2. That's it.
Between my first, middle, and last name, I have 26 letters. So it's
There
like
you
the
go.
alphabet. So. I didn't do that to my kids, though. Actually, I did do that to my kids, unfortunately. One of them,
Really?
Salvatore, too. So,
Ah, well.
yeah.
That's good.
You have to do that.
So when we took a brief 3-minute break, we were talking about election reforms. Should we get back to that subject?
Yeah.
So start it from scratch?
Yeah. Let's talk a little bit about this. So this is a bill that is, there's one version passed by the State House and one by the Senate.
Has it been passed?
Well, in both branches.
Yeah,
yes.
okay.
But, and Sal's part of the committee to actually reconcile. So tell us a little bit about, or as much as you would like, about
Sure.
the whole package.
Sure. Well, the House put forward 2 proposals for early voting and online registration. Those are the 2 issues that they put forward in their bill. The Senate went a little further. We have 8 items in our bill, which we know when they have 2 and we have 8, we're not going to get 8. So I've been appointed by the Senate President to serve in the conference committee to reconcile those differences. We have 3 senators and 3 representatives on the committee, 2 Democrats from each branch and 1 Republican from each branch. And now it's our job to find common ground between these items that are out there. The 2 items that are in the House are also in the Senate bill.
Right.
But we have 6 additional bills, which I mentioned before. One was pre-registration, which is my bill, and I think it's an important bill to get kids engaged and get them more involved in the process.
And that would register children,
Well,
young
Teenagers,
people,
yep.
at age 17?
16
16
and
or
a half,
17.
and then they can, and 17 as well if they wanted to, and they could do it in the high
So
school
they-
classes, in the civics class.
Right, so they'd be in the queue,
Right.
but not eligible to vote until they hit their
Their
18th
18th birthday, right. And that's been, in some cities and towns, that has been, not controversial, but it's been an issue for some of the clerks, because they thought they were a little too much work for them, but I'm not gonna go there right now
Yeah,
with
don't
that.
go there.
But they, 16-year-olds and 17-year-olds, they wanna be part of the process, and if there's a way that we can get them to be there and to feel like they're a part of it and feel like they're more important to us, then I think we should do it. We complain about all the time about our youth not being involved in the political process, which is true in most cases.
Mhm.
Our senior citizens come out in droves and they vote, and they get a lot of attention at the State House, which rightfully they should. So on early education issues and issues that matter to our young people, sometimes those aren't as they're not brought out to the forefront as much because people know that they're not watching,
Right.
they're not voting. So I think this is a way to at least try and get them more involved, and stop talking about it, just do it.
Right.
And you could register at school, right?
You can register at school, the
Makes it
registry of motor
easy.
vehicles. You can register when you get your learner's permit.
Perfect.
There's a lot of different ways a lot of easy ways for you to register.
It's to engage people. It's
Right.
what we've been asking for.
And when they go off to college, as I mentioned before, they're gone for 3 or 4 years, and those election cycles that are going by, they're not voting. And who knows when they come back home? Then who knows how long it's going to take for them to register to vote at that point.
Yeah.
So this is just an easy way, I think, of getting them in the process.
Now, early voting is basically just opens up what people do is for absentee voting, right? Isn't that what that is?
They can vote. Yeah, they can go to the city hall and they can vote.
They don't have to lie that I'm out of town. They can actually
Right.
just choose to vote early.
They can, yeah, and a lot of states do it. And a lot of states do it successfully,
Now,
and
is that one of the ones that both branches agree on?
they did.
Okay,
They did. So that should be in there.
we should be good with
That we should be good. Now,
Good.
there's also about which elections does that apply to? Presidential only, city elections.
Oh.
So it's not just about saying we're going to do this for all elections. We have to figure out, if
Is there
both sides
common
agree.
ground on that?
I hope so.
Okay.
Well, it seems that there's been
No, I mean,
more.
did the bill
It,
have?
it doesn't mirror each other. It
Okay,
doesn't mirror each
that's
other.
all I meant.
Yeah, but I think
I don't
one
want secrets now.
one thing
No.
that probably could be said is that it's an idea that's happening more around the country.
Right.
So it's not out of the mainstream anymore.
No, and again, we want people to vote. That the goal is to
Right.
get more people to vote.
Right.
We all say as candidates, you try to hit every home, you try to call every person, and then election day, no one votes. So this is an easy way, I think, these are small measures that could go a long way.
You know, now I'm gonna sort of sound like the geeky mathematician, but to me, the issue has never been how many people vote. It was more, the question was, how representative a sample
Right.
of voters, are they, in other words, if you have, if the median age of voters is 60, and the median age of citizens is 35,
Right.
then by definition, this is not a representative sample.
Right.
And, or if you had people from certain communities, certain neighborhoods who just chose not to vote and other people did vote, you know, you end up with this rather lopsided lack of representation.
It's
as
true.
a
Well,
result.
and early voting would address some of that too, I think, because.
Yes, it gives more flexibility.
Right, so if someone's working, 8 hours, 10 hours a day on election day, and they know that they're gonna vote early. And,
Right.
and that's why seniors have a high percentage of, the percentage of voting is very high. Because and a lot of times, they're voting in the first floor of their homes too.
Right.
So, for us to try to bump these numbers up, something has to be done. We can't just keep going by what we have and hope for the best.
Well, Robert, I think we found our first point of dispute in public between you and me.
Uh-oh.
Uh-oh.
And I'm staying in the middle.
I think elections aren't so much about a representative sample. I think that it's about getting as many people to care about their government and go out and express their viewpoints. And I do think it's about
No,
getting the most
I'm
The
gonna be
most
moderating a debate
people-
right now between the
A
two
little
of you.
bit.
to actually go out and vote.
I want to see voter turnout as high as possible. I'm not going to in any way disagree with you about that. But the thing is that to me, the thing I find most disturbing is just when you have a completely unrepresentative sample of people voting, because then what the people they're electing are not necessarily representative of the people, right? But hey, listen, when we elect 40 senators, we're not having everybody in the state vote. We're only having 40 people vote. And as
That's
long
right,
as they're
that's right.
representative, we're good.
Well,
That's
see,
right.
for me, the
Yeah.
most disturbing part is when you're out there talking to voters, trying to get them to vote for someone, and some people will come up to you and very proudly say, "I don't vote. I'm not
Right.
interested in voting. Don't ask me to vote.
Right.
I'm not engaged." And that upsets me.
It upsets me too, but in a way, that's a vote. They're choosing to not vote. If it's a rational decision, I can respect it. If
I'm
it's a
sorry
But
to
I-
do this to you.
I'm gonna, but those people that wanna do that though, they can go in the voting booth and blank the ballot.
Exactly.
People do.
And that's a message,
That's
more
right.
so than just saying it on the street,
I agree.
that I don't wanna vote because.
That's the right way to do it.
Right,
Yes.
cause people, I hear that sometimes, you're not making a difference, their vote doesn't count. I won my election by 138 votes.
Yeah, it does make a
You know,
difference. It
my
matters.
election, I tell this to kids all the time, I speak at a lot of schools throughout the year. And I get the looks, the glare in the eyes from some of the kids thinking, I can't make a difference, nothing's gonna happen.
It makes
My
a
vote
difference.
is just gonna be one of thousands of people. And I tell them that my experience in elections, I lost my first election by like 80 votes in the Everett City Council. I won my first state senate election by 138 votes,
Which
1% of the vote.
is a very small number of
1%
people.
of the vote, and I tell them that all those votes that were cast that day made a difference, not just for me, my family, every constituent across my district, because those votes put me in office.
That's right.
So my priorities and me doing what I have to do for this community dictated by their vote. And when people start hearing that, I think the presidential election, they look at those numbers and say, does it matter? It matters even for that. It matters, every vote
Yeah.
counts for everything. But in a state senate race, winning by 138 votes, I just say thank you to those people who went out and voted that day.
Yeah.
Because it really makes a big difference. And when you're dealing with 1% of the actual vote, I won my second state senate election by 198 votes.
Right.
So it wasn't like we had
It's
this,
huge.
10,000 vote swing. And I'm just lucky that I was on the right side both times. But I think we have to show them that their vote does matter, because a lot of people are so cynical about the process today. They watch all the bad press on TV. They look at that and say all elected officials are the same. They don't think that, what they do can really matter. And
Yeah.
we have to get back to the basics and let them know that what they're doing really does
Right.
matter. And this law that we're passing will allow more people to get engaged, and and we have audits in there. We have different things that will give you more trust in the system too. So, This whole package that we've been doing is long overdue, and it's about time we're putting it all on paper and putting it done, you know, as Robert said before, instead of piecemealing it. You know, we put
Right.
one big comprehensive package together that applies to the entire state.
Right, yeah, when we've seen home rule petitions or whatever for little minor amendments and things specific to Cambridge, I always found it a little unsatisfying because I didn't want to see every little city in town do things differently. So this is the right way to do it.
Yeah, well, this comprehensive package, you know, when you have 7 or 8 things that are really meaningful, that are just not added on just to be added on, that really can you know, make the process better, this is the way to go. And we've been talking about it for the last, since I've been elected office 4 years ago in the state senate, and we finally have an opportunity to get it right.
So what's the time frame now? So you got something, again, this is part of the making of law and sausages that I
Right,
never fully
right,
understood, but
Right.
so you've got 2 branches of the state legislature who have passed different versions of
Right.
something. You guys just sort of go out for over beers? What do you do?
Well, if they're going for beer, I'm not gonna be there, but yeah, we just sit down and we talk out the differences.
Well, is that
and-
something that might happen like this month?
Yeah, it's
next
gonna,
month?
it'll happen.
It's pretty tight?
Yeah, no.
present?
They
yeah,
give you
no,
a
it's-
deadline, don't they?
No, they don't
No?
give you a deadline, but we have,
Well, the end of the
our
legislative
session's gonna
session,
end
right.
in July, so we have to get it done before then, or else if we don't do it by then we have to file it and start all over again in January,
Right.
which we know that's not gonna happen. So we'll have a bill that'll be tightened up and signed by the governor before we finish up the session.
So I'll keep it on my radar.
Yes, yes, for your website, yes.
Absolutely.
That's what everybody looks at in Cambridge, so, you're the authority on election results and all the numbers, so.
Well, do what I can, absolutely.
He doesn't wanna say, he's being humble now, right?
It's okay.
That's where I look when I want some information.
Yeah. Actually, there were a couple of other quick things, if I might diverge for a minute on things here. You know, couple of little quick news items. One of the things was kind of interesting as we were wending our way over here today, just up the street, because we're right here on Mass Ave, right up the street at Brookline Avenue. They're actually they're constructing right now a snowboarding apparatus. They've actually
Right.
closed down the section of Brookline Street for some kind of a winter carnival with like snowboarding demos. I thought we were going to have a horrible traffic nightmare,
Yes,
but
it
didn't
was- it's
seem
fine.
too
Very
horrible.
easy,
fine.
no problem at all.
So maybe we should just do that more often. That would solve all the traffic problems.
That's
eh?
great they're doing that because you know, anything that brings the community together, it's really, you know, Cambridge, again, I keep saying Cambridge is always above the board. It is, because the cultural festivals, the different events that we have throughout the city, and for the most part, they're all free.
Yeah.
You know, so you have a way to bring the community together multiple times a year, in different weather, different issues, different aspects, and it's something for all ages. It's really, it's a great place to grow up, to raise a family, to work, and you never know what you're gonna find walking down the street in Cambridge. You really just don't. So, and we have so many great neighborhoods in this city that really aren't the same, but are the same. But so it's nice.
Every place has its own little twist.
It does. It really does. You know, when I grew up in East Cambridge, when, you know, 1970s and early 80s, it was all, you know, Portuguese and Italian families, and things have changed. Now we have a lot of the younger adults coming in who work in Kendall Square. They want the proximity to Boston, and it's just, but the fabric of the community never changed. You know,
Right.
you know, the festival still continues. The old folks that are coming out that really tie the community together are still out there doing their thing. So it's a great place to be, and I'm in Cambridge all the time. You know, my parents still live here down the street. My son's over their house right now while we're taping tonight. So
You
Right.
should have brought him over.
he wanted to come.
we go.
You know, I
Oh.
have one that's
Is he
skiing.
watching?
He's watching. Yes, that Matthew is watching. Yeah.
Matthew, if you want to call in, ask your
No,
dad a
don't call
really
in
hard
Matthew.
question.
No calling in Matthew.
Now's your chance.
Right.
I'm glad he's the one that wouldn't call him. My other son would definitely be on the phone right now.
Actually, there's one other bit of news. This is a little more on the sad side, but someone who's often been referred to as the mayor of Central Square by many people over many years, Karl Baron, passed away on Saturday, the February 15th, I guess that is. Karl was he and I both served until his passing on the Central Square Advisory Committee. He was a former, longtime president of the Central Square Business Association. And one of the biggest benefactors of things like scholarships,
Right.
Every year.
built a wing for men's health at the Mount Auburn Hospital.
Well, he and his wife
He
actually
and his
were
wife
big on
Ruth,
scholarships.
right? And it was actually interesting in the photo I saw yesterday, because I mean he always referred to Ruth, his wife Ruth, who passed away several years ago, as the boss. And they were in a news article that I was reading yesterday, had a picture of Karl a couple of years ago, and he still, even after Ruth was gone, he still kept the nameplate on his desk. It said "Assistant to the Boss." Anyway, he was definitely a friend.
And
sorry to
speaking
see him
of
go.
events and festivals, I don't think there was anything in the city that didn't have his name on it. You know, he was a supporter of every event that we had in the city. I even know, you know, our festival in East Cambridge, he was a supporter of that.
Yes,
You know, everything that was good in the city, he helped.
and he lived in Belmont.
Right.
But
right.
he was a major
Yeah.
figure in terms of the business community, and he understood that, you know, if you're part of the business community, you do business in Cambridge, you are part of Cambridge,
Right.
and you owe Cambridge your attention, and he gave it freely.
And every year, at the end of the school year, when they'd passed out the awards, he and his wife always came to meet the students.
That's
And
right.
that was very impressive to
Right.
me. They always showed up.
Yeah, no, he
It
was
was
missed.
good.
Yeah. So, so let's see. Now you tossed out a number that I kind of was a little stunned at earlier.
Yeah.
You said that is it each year or each session there is in the neighborhood of 5,000 bills
Session, each session.
It's-
So every 2-year session.
filed?
So, you know, there are a lot of bills filed every session, and most of the bills are filed at the beginning of the session. But throughout the year, things pop up and things happen, so you are allowed to file bills, late files, they call them.
Right.
So, then every bill goes through the committee process, has a hearing, people come up and testify for and against, and then it has to be reported out of that committee, then it goes to the Ways and Means Committee, and then it gets vetted again at that committee level.
Yeah.
We need to streamline
And
this.
to
you
make
know?
sure
No,
that,
no, we don't-
that
Just
nothing.
ask
A
Sal.
lot of
Sal,
times
you
we
all right
don't
to
want
Sal?
these bills to pass. There's a lot of
S-
weird
some,
bills.
Some bills are a little out there, but
Really?
yeah, some of them you wouldn't want to.
You don't sort of publish like the annual sort of legislative comic book of funniest bills?
No, but we could. We definitely could. It'd be a full book too.
Now,
but-
I know that in some places, it is a tradition that if a citizen says, here, I want this bill, so is there some sense of an
There is.
obligation that you, as a state rep or state senator, you would file the bill for a constituent?
By request, exactly.
request?
Yes, yep. I have done that in the past, and it's that person's name is on the bill,
Really?
and it's done by request. Yeah.
So I could file a bill?
You could file a bill. You
Really?
could definitely file it. Every citizen in the state can file a bill.
And we'd add it to that comic book.
So I could name the square here after Susanna.
You could.
This could be Sagat Square,
Right.
Right.
I'd vote for that.
right?
Thank you.
Say I'd vote for that.
All right, let me just write this.
There's no square out
Just
there.
make sure there's no one else's name out there
Yeah,
to take it
there's
back.
no square
Actually,
out
there is. No.
Yeah, no, and it's been great too. You know, obviously going to the Harrington School, growing up in the city, and seeing how proud everybody is of our success. You know, I want to say the people of Cambridge has made me what I am today. So it's been a great ride. We've got a lot more to do. But
Don't talk about it in the past tense.
no. So we have a lot more to do.
What?
We have a lot more to do, but it's been great.
Let's see, wait, this is my
This is
district.
big news.
I could consider a career move
No,
here.
where's he going?
No.
Mr. DiDomenico?
No.
I-
There'll be no announcements tonight, but
All right.
So we were talking before, and just to move it back to
Yeah.
normal, in the last half
What do you
hour
mean?
about early education and care, and about funding education for young children.
right.
You filed other bills. You have other interests. Do you want to tell us about a few others?
Sure. Well, healthcare is also the big white elephant in the room too. Making sure that all of our kids are insured. We're lucky in this state. I know there's a lot of bad press going on about some
What's
of this
happening
stuff.
with healthcare now?
It's more complicated. If we had
Okay,
4
let's
hours,
forget it.
if we
Okay.
had 4 hours, we could talk about it.
We'll do it in the next
But the
show.
premise of having everyone insured and having all children insured is the right way to go. There's no
Okay.
question about that. You know, we live in a country that, why shouldn't everyone be insured in this country? Why shouldn't every child have that opportunity? You shouldn't be, denied coverage because of any kind of condition. My wife has diabetes. She had diabetes starting when she was 11 years old. And, and some companies could deny her coverage because of that. It just, that's not the way our country should work.
Right.
So for me,
Yeah, pre-existing
Well,
conditions are.
it's a big
Big issue.
issue. It's a big issue. And, you know, with the premise of we should all have health care, I don't think anyone should disagree with that, you know, and if they do, find me a good reason, and maybe we can talk about it. But, can we do a better job of making sure we get the process tightened up a little bit? Of course we can. You know, we've seen that there's a lot of improvement to be made.
Yeah.
So we have to do that, and at the state level, we actually work on that a lot. You know, people might not see the background on that, but we're always talking about trying to make things more efficient, make them more streamlined, make them easier for people to sign up for. So in the
That's
coming,
good to know, because we have no idea that's happening.
yeah, no, and unless we say it, people don't
idea.
see it, and they don't know what's going on. But there's definitely a lot of work being done to try to manage that.
It's actually a pretty big problem. I think, was it one of a woman who was in charge of like something with the website actually was very apologetic in a public way
Right.
the other day because of some of the glitches and things. People had long waiting lists. People wouldn't get back to them when they were trying to sign up for this because I think people who were getting one form of like Commonwealth care, there was some switches that were going into place,
Right.
and it wasn't going smoothly.
Right. But the one thing we should be very proud of in this state is we were the model for the national program.
Yeah.
And we did it first. We have, I think there's 99% of the people that are insured in this state. The numbers are staggering in
It's
terms
wonderful.
of, our state, again, is the head of the curve. We're one of the more progressive states on a lot of issues, and healthcare being number one. So we really should be proud of that and not run from that.
Right.
And, you know, we are the test model. It worked well here, and they rolled it out nationally, and now we have to teach them how to do it a little better.
Well,
Keep
This day
working
and
on
age,
that,
we'll keep
please.
working. We'll keep working, but it is a good thing to have healthcare for everybody.
I completely agree. One thing that was sort of a little bit problematic when universal health care was instituted, at least for Massachusetts, was that the model that was basically funding Cambridge Health Alliance
Right.
was sort of based on what was called the free care pool, and they pretty much sort of built their services pretty much for serving, you know, indigent care and whatever. When the health insurance law went into effect, people could sort of pick and choose where they wanted to go. So
Right.
it actually put Cambridge Health Alliance into a bit of a tough position because they weren't just going to be filling the beds because a lot of those same people were going elsewhere then. And I don't know that they've really still worked that out. They're still sort of, you know, in a little more of a financially risky situation. as
Yeah,
a
no,
result.
yeah, the Health Alliance is always, it's a priority of mine, obviously, because I was born in Cambridge Hospital, and I have Whidden and Everett. So those two community
Mhm.
hospitals are very important to me, very important to my constituents. You know, I go to Whidden for the emergency room all the time. My staff knows I'm up there all the time. And they take tremendous care of everyone that walks in the door, you know, no matter what their status
Yeah.
is in terms of, you know, insurance or not. So we have to make sure we support those hospitals because, you know, people come in and there's no way of paying, and they still provide the services to them.
Right.
There's very
And-
few public hospitals left.
Very
Very
few,
few.
very few. And, you know, and in my district, I have Mass General, I have Cambridge Hospital and Whidden, and I have Spalding Rehab.
Wow.
So it runs the gamut from,
It's
the,
huge.
you know, from the, you know, a hospital in Boston that's considered one of the best in the world.
It's a city.
Right, right. And you know, and then we have, you know, Cambridge Hospital that just does amazing work with a limited amount of funds and stretches every dollar
Yeah.
and does amazing work. So we have to find a way to balance that because we have to make sure everyone has the same opportunity to get good procedures done and get good health care. And it's important. It's one of the most important things we can do as a society to make sure everybody has that kind of coverage.
And the legislature has something to do with some of that, right?
We do. We definitely do. And you know, we have helped CHA with the reimbursements from the federal level.
Federal level.
Right.
And that's been a big issue because
It's like almost
you
an
know,
annual procedure.
it is. It's an annual procedure. Is not. It's being very kind.
Well,
so I appreciate you.
Annual crisis, perhaps.
Yeah. It's something that we continually have to stay on top of because if we don't, then things wouldn't happen. So
Right.
we have strong leadership at the CHA. There's a great work, and we're lucky to have them doing. I call it God's work because those community
Mhm.
hospitals do a lot of good things for a lot of people that couldn't afford health care.
So what are some other bills? Oops, sorry.
Well, public safety is a big issue too, you know, gun control and making sure that we could, you know, we see all the headlines that are going on across the city and across the state. We have to do a better job of getting guns off our street and making sure that our community feels safe. Shannon Grant money, which is community, you know what Shannon Grant money is, but
No,
people at home
tell
don't
us.
know. Shannon Grant money helps with gang violence, getting educating our kids to stay away from all the bad stuff that you would find in the community.
And how does the
And-
legislature help with all this?
We appropriate funds for the Shannon grants, and every city and town applies for these grants. And it's based on need, and it's based on showing, data-driven, obviously.
I see.
So we've done a lot of good work there, and the Shannon grants, it's like everyone fights over that money.
Right.
That's something that's sitting there, and it's been.
People want it.
They want it, they
That's
need
great.
it. It's not even they need it, and we need to keep, putting more money into that. And supporting our public safety officials, because we know what they do every day.
It's very hard work.
It's hard work, and they put their lives on the line, and they leave home, and their families are home, and they're crossing their fingers sometimes and making sure they come home, so.
Yeah.
All right, I'm gonna ask one last question.
Sure. And it's a fun question, I can tell you, you
No,
smile.
no, it's actually a pretty tough question.
Tough question,
There
Not the
were,
last
there was
one.
a lot of local controversy, and it was really statewide controversy about funding for the MBTA.
Yeah.
And, everybody, certainly from Cambridge was gonna say, we're gonna seek some legislative solutions. Was that ever really resolved, or is that something that's gonna be kind of continuing to be a problem?
We have $800 million we put into that fund. That was a lot of money, but not what the governor wanted. The governor wanted 1.9 billion. He has filed another bill to address some of the issues, the older trains and the repairs on
Yeah.
the line, and that's something we're going to be looking at in the near future. But he filed a bond bill to a lot of money to address that. But it's important. There's no question. Leachmere Station, when I was a kid, that was our lifeline into Boston.
Right.
And it is for a lifeline for a lot of people going to work. And, that a lot of people don't have cars.
Pretty soon it'll be just another stop on the Green Line,
That's right. It'll be just keep going, go right by Leachmere.
right up to West Medford.
But it's transportation is a big issue, and ethanol trains are a big issue. Keeping that off our tracks. Like I said, we stopped them in the tracks, which we did.
Yep.
With the Senate
Good
amendment,
job.
with the help from the House members and our colleagues in the legislature. But it was a lot of good work, and we're ready to close up. So you
Anyway.
can finish up.
Well, we gotta sign off now, so,
This was a really fun show. Will you come back?
I will come back.
Oh, we're
Thanks
really
for having
happy
me.